Hi, it's Dr. Ryan French. If you suffer from migraines, there are 2 specific self-massage techniques that you can do to help get you through those nasty headaches, or help once you feel one coming on to help keep that from going to a full-blown migraine. So the first one is to work in what's called the suboccipital area. So the suboccipital area, so the back of your skull is called the occiput. So suboccipital is below that. It's where your neck meets your skull at the back. In the suboccipital, there are 2 nerves that come out of there, the greater occipital nerve and the lesser occipital nerve, and they come around the head. And those are the 2 main nerves that are often involved in the perception of different types of headaches, including migraines. And those nerves, they come out from the upper part of the neck. The atlas bone and the axis bone are the 2 bones in the neck that the positioning of those can affect those nerves, as well as 4 muscles. So the rectus capitis posterior minor, rectus capitis posterior major, I know that's a mouthful, the obliquus capitis inferior and superior. But those 4 little muscles, and each of them is only about this long, are right up at the base of the skull. So the technique looks like this. You take your 2 index fingers, put them in behind your head, and then wrap your hands around and cup them over your ears so you feel a change in pressure, like as if your ears were decompressing coming down on a plane. And so you hold them in that position. I'm pushing in with my fingers and holding. Now I'm not squeezing my head, but I'm pushing in and I'm cupping over my ears. I count to 10 and I take some deep breaths. Deep belly breaths. And you hold that for 10 seconds and you'll feel a release of tension that affects the pressure in and around your head. So that's the first technique. The second one is, a lot of people don't know, but you can actually get migraines and headaches coming from problems in the jaw area. So there's a big muscle called the masseter. It's the one that you use when you clench down. And so if you clench your teeth, you can feel it sticking out. And what you do is you just massage it. I think that looks a little bit funny, I just saw it on camera. But just massage it one way and the other way. And then you'll come just above, in front of the ear, and this is called the temporalis muscle, where your temples are. And you're just gonna massage that area. And again, you can massage it for 10 to 15 seconds. If it feels really good, you can do it for longer. But those are 2 tips that I give to my migraine sufferers that can help them at home. I hope you find them useful. Thank you.